welcome back to Let's Talk Patient Blood Management. Are you or a loved one expected to have a surgical procedure done in the next year? One of the best ways to ensure the best possible outcome and recovery period is to engage with your blood health while planning for your surgery. Today we've invited Dr. Fredy Ariza, anesthesiologist, to discuss the important role of patient blood management in surgery. We will discuss what things are the responsibility of the medical team and what role you play as the patient in your own blood management. If you're not sure how to fulfill your role, no worries. We'll be discussing all of this today.
I'm so looking forward to talk to Fredy. It's been a little while. Hi, Fredy.
Yes.
Hi, Sarah. Hi, MaryAnn. It's a great pleasure to be here and share our experience and your great experience in PBM.
Thank you so much. How about I'm going to give a little background on Dr. Ariza here, okay? So Dr. Fredy is an anesthesiologist at the Foundation Val de Lilly in Cali, Colombia, beautiful country, and associated professor at the ICESI University. His current work includes the academic coordination of the Anesthesia for Solid Organ Transplantation Fellowship Program, and he also collaborates as the Latin American coordinator of the Ibero-American Society of Patient Blood Management and serves as the Patient Blood Management Clinical Advisor of the World Federation of Society of Anesthesiologists. That's awesome. Thank you so much for joining us, Fredy.
No, thank you very much for inviting me. I'm more than honored to be today talking with you about PBM.
When people plan a surgery, a lot of times they think about in their planning, what day is best for me to have this surgery? Do I have days off of work coming up that I can take for my recovery? What day can I plan to have someone with me at surgery or to take me home from the surgery? One thing that I think gets overlooked is patients don't think a lot about their blood health and maybe how they could improve their blood health for the best possible outcome and the shortest recovery times. Why do you think considering your blood health before surgery is really an important thing for someone to think about?
A surgical procedure is like a marathon. Yeah, at the end, you have lost a part of you during the surgery, and we need to reconstitute with our food and other strategies to return to our state before surgery. So asking yourself and your physician about your blood health before scheduling surgery is crucial for several reasons, because if you know your blood status, you are able to know your risk before surgery. For example, understanding your blood health allows your healthcare team to assess your risk factors for complications during and after surgery. Factors like such as anemia, clotting disorders, and other blood-related conditions can affect your surgical outcomes and recovery. For another example, it's for prevention of complications, identifying and addressing any underlying blood health issues before surgery can help prevent complications such as excessive bleeding, infectious adverse events, and delayed wound healing, for example. It's important for optimizing your preparation before surgery. If you have anemia or other blood-related concerns, your healthcare team can take steps to optimize your blood. This may include dietary changes, iron supplementation, and other medical interventions to improve your hemoglobin levels and overall blood function. Discussing with your surgeon about personalized treatment, planning tailored to your specific needs or medical history. This ensures that your surgical plan takes into account and any potential blood-related risk and incorporates appropriate precautions.
Should this be like the day before, or should this be 30 days before, or how long should this be ideally,
Um,
if you can?
it's very very interesting question. I think that the best time for make this is 1 month before surgery.
Hmm.
If you have this time, you have the opportunity, the chance to improve your health with new drugs, new medications for improve many blood conditions.
I like to tell people from the moment you find out you're going to have a surgery, that's when you start planning.
Yeah.
Important questions to ask your doctor is, how much is the expected blood loss of this surgery? Is it a lot or a little? How do I feel
Hmm.
about blood transfusions or donor blood? Will I accept it at all? Do I want them to wait until it's life saving? Or do I have no objection at all? The team needs to know that. Also, I think it's really important is to know, is there anyone with you today that you would want to make medical decisions for you
Hmm.
if you're not awake and we run into a problem? You want to direct them towards those people. And so there's a lot of planning on your part
Yeah.
that goes along. And also, you want to talk to your family about how you feel, not only about to your doctors, but you want to talk to your family or whoever is going to be with you, how you feel on these topics.
Oh, Sarah, there are a lot of situations, but it's important that patients or you as a patient thinks on the importance of planning and take decisions in difficult circumstances. And if I am a patient, I need to be sure that my family knows my risk, what's the complexity of my procedure, and we are not against the transfusion as a urgent measure for an emergency. Frequently, their surgeon or their anesthesiologist are not aware or other strategies for using during the surgery to reduce, and we are blunted by the full trusting in transfusion, and
Mm-hmm.
Yes.
this is we have been historically wrong on
Mm.
this.
I think too, you probably agree with me, but the anesthesiologists that I work with, they try to inform the patients on the day of the surgery about medications that they're taking or supplements or even things that maybe are non-traditional. They try to say this all affects your safety. It all affects possibly your blood health or your bleeding and clotting factors. And I'm not sure if patients really understand how much medications and things that they're taking plays an important role, but I'm sure you agree that if you don't tell anyone else, please tell the anesthesiologist before I put you to sleep if you've taken something.
Yes, yes, Sarah. Not only your anesthesiologist, your surgeon has to, to know all your medication, all your supplements, your food supplements that are you taking at the last weeks before surgery, because there are important implications with your this type of medication that you obtain. This is obviously a high risk to not inform to your surgeon or your anesthesiologist about all these supplementations that you are taking,
Mm.
because there are a lot of interactions with
Yes.
your capacity for make clots with your
Mm-hmm.
blood.
So, so far, we have a couple of good points here. For our listeners, you should be looking at your blood health really now and prepare yourself in case that you have a surgery in the future, because so many surgeries are not planned.
Mm.
And I think it's really important to, get an idea now. But truly start, especially the day that your surgery is scheduled. Ask questions, ask a lot of questions, know what to expect, and talk to your family and loved ones now about your wishes before, so there's no question about
Yes.
what should be happening. One thing that we do that's pretty common in my area is anemia, iron deficiency anemia specifically prior to surgery. And I think it's pretty common throughout the world, a problem before surgery. So, do you have a process in place for identification, treatment, manage of anemia for preoperative situation?
Yeah, Marian, we have worked in the last 3 years on this for implementing at least clinical routes, hospital clinical routes for the assessment and optimal management of anemia. In my institution, we have started to defining the clinical routes for guiding teams what to do about optimally assess and treat anemia. And first time we define with my laboratory the availability of tests for discriminating anemia. This is important because in my country, in our national health system, you need to be supported by labs for confirming the anemia status and the etiology, the cause of the anemia, to obtain permissions and not to be against the law or the policies. Once the ferropenic anemia is confirmed, they take the measures for promptly direct patients to our infusion service. We have an infusion service in charge of recruit patients and following them when they need chemotherapy, parenteral iron therapy, or other infusions for their situation. The patient's health insurance for authorizations doesn't start the treatment without a supporting lab. It's important for us to be in this way.
What would you say to a patient who is scheduled for a surgery and their physician says to them, "Oh, don't worry about it. We don't need to look at your blood health. You'll be fine." How would you advise your friend?
I'm dedicated to major surgery and trauma, and I see all everyday patients with anemia after the procedures, anemia before the procedures, and not to take in account the blood health status. It's very dangerous, not only for the patient, dangerous for the institution. The outcomes are in risk to be the worst. Your hospital finances and economy goes to down. Many aspects that are in risk for not taking account the status of your health, blood health, and before surgery. A good start is a good clinical examination. Yeah, it's important to be clinical in this. We need to understand what's the complexity of the procedure, what's the risk of the patient, and decide if my patient has a medium or a middle or a high risk. I need to know what's the blood health status. It's important. The clinical context will guide you in the aspects to cover and the investigations and all the or you need for define the risk of your patients.
Now let's switch and move on to the day of surgery. So the patient has done their part and they have planned for their surgery and their blood health. And then they arrive on the day of surgery where you kind of take over the responsibility. They're going to go to sleep and you're going to now manage their blood health for a while. Can you tell us a little bit about what you do as an anesthesiologist during the surgery to protect their blood health?
I like to talk or spend time with the patient for the last day before surgery. It's important for me that my patient knows what to do the last day before surgery. It's important that you make your usual life before until the last hours before surgery. The last night may be as normal as possible. And the hydration of hydration is important for maintaining your blood health. For example, people goes they tried before surgery, and it is a big problem because we have at the start of the surgery patient wrongly prepared, they traded, and with a high risk to being shocked during surgery, with a poor tolerance to bleeding, for example, if against to be in a good blood shape and good bulimia and good blood volume before your surgery. And I would like to say that I will try to improve your blood conditions and make your hemostasis, your clotting function being the best and improve the situation. I need to help your surgeon. He needs me to maintain your blood in the optimal situation. For example, if your surgery is related with high risk of bleeding, we will take the measures, the best strategies, like for example, medications for optimized hemostasis and medications for a best tolerance of anemia.
Dehydration. I don't know that I had thought about that before, but it really impacts the blood health, the status of the patient going into surgery.
Oh, it's a strong, there's a strong relation between the hydration and, for example, hypercoagulability. The high risk to be a venous thrombosis or other big problems after surgery. To be hydrated, well hydrated before surgery is an standard. It's important, highly important, of a highly importance before surgery. All the guidelines for fasting guidelines has changed in the last years and warranty to offer until 2 hours before surgery drinking clear liquids, clear fluids before surgery, like water, carbonated drinks, or other clear fluids.
Well, that's something we can certainly add to a patient's, preoperative. Make sure that you stay hydrated in the days before your surgery.
Yeah.
I was more familiar with if they're dehydrated, we won't be able to find a vein, but it's so much bigger than that, right? It's more than just getting their IV placed. And then you said you have some medications that you can use that can and sort of help with bleeding or coagulopathy. So that's one of the tools in your belt on a high-risk surgery. How about cell salvage? What is cell salvage? Can you explain that to us?
Yeah, great point. Cell salvage is a way to recover blood from the surgical field for processing and purifying, and then retransfused to the patient. This is perfect because it's the patient owns blood. The ultimate generation of these devices are incredible. Are incredible because they can save not only red blood cells, platelets, and some factors. So if we have a high risk of of bleeding, for example, in cardiac surgery, transplantations, or major abdominal or thoracic surgery, to plan to include cell saving in the perioperative plan is perfect.
I've heard you talk about patient warming and that's really important, that the patient doesn't get too cold during surgery. How does that impact their overall blood health?
Most of the surgical teams are not aware of the importance to maintain, to keep the optimal temperature, to optimal body core temperature, because temperature is necessary, the optimal temperature is necessary for be perfect in hemostasis, in oxygen delivering, and cardiac function, cardiac and brain function. If you are too cold, or you don't receive an active protection against hypothermia, you may fall in a very bad state of low hemostasis. You enter in a high risk of bleeding. Your heart doesn't work well, and everything complicates. So I recommend for surgical teams to implement a policy of thermal protection during all the procedures, not only during the procedure, no, before the surgery, during and after. The protection against hypothermia needs to be a necessity for improve the quality of care in our surgical services.
Can you tell us how you do that? Because the patient is generally wearing a very thin gown, or sometimes that needs to be removed depending on the surgery. And then we know that operating rooms are kept rather cold. How do you keep the patient warm then to protect them?
Okay, there are a lot of methods. Some very simple method is not to make the patient get nude during the last hours before surgery, protect themselves from environment with blankets or other devices with active warm air. It's possible. It's possible. As you know, the environment in hospitals are too cold. These areas for receiving patients from home needs to be conditioned with a controlled environment and with the optimal temperature for make the patient doesn't cold. And during surgery, we use air force blankets and other systems for maintaining the core body temperature optimal. Even with all these strategies, we suffer a high prevalence of hypothermia. So we have to take a combination of methodologies or measures for improve the patient and makes the patient goes to the normal temperature. And after surgery, all the recovery room postoperative units needs to continue this process, protecting the patient, not only the patient, no, the family against the wrong environment, not optimal environment for patients and their family. At the end of my days in neurosurgery, I have a headache and feel not better because the room is too cold, too cold. And this is seen by surgeons like good for the patient, and not the room is not a refrigerator. The room is with a patient that is without the defense mechanism to optimize their own temperature. You need to actively warm the patient and make sure that the patient is the center of the room and all the team is around him or her, guarantee the best conditions for make the surgery in the safety and quality conditions.
Yeah, and that's what I see in our OR. Little things like just allowing them to keep their socks on until they have to take them off, or even if they have to take them off, to keep them warm with blankets. We do have the forced air warming blankets in our surgical suites that, like you talked about, that are kind of under the surgical drapes that kind of keeps the patient warm. And also the
Yeah.
fluids like the LR, the normal saline that we give them during surgery, those are warmed so that they're not
Uh-huh.
cold going into the body, or any type of irrigation. We try to give them fluids that have been warmed so that we're not shocking them into some cold. So those are some ways that I've seen in our OR that we try to keep that patient warm, but it still is pretty difficult because, you know,
Yeah.
you're in a cold environment.
Yeah.
So, yeah.
Fredy, you deliver the patient, you're all done with the surgery, they go to the recovery room, and from there, the recovery team, ICU, or the surgical unit, they need to continue to focus on the patient's blood health. Is that correct? And what role do they play? Or is
Oh,
there no more need to worry about anemia
no.
after the surgery?
Oh, yeah, it's a very, very, very good question. The role of recovery rooms and other postoperative service who admit the patient for the final care during the hospital, during the stay in hospital, includes to continue the work of patient blood management. It is crucial for ensuring optimal patient outcomes, especially in critical ill patients who may have complex conditions and significant blood management needs. We need the continued monitoring and assessment. We need optimize the blood conditions for reduced transfusion. Many patients need another interventions, not only during surgery. After surgery, they need to optimize hemostasis, fluid management. So it's important to maintain the warming and care chain for all during all the stages, preoperative stages of the patient. This is a multidisciplinary collaboration. If we don't understand this is a multi-professional work, the PVM is impossible to do.
Mm-hmm.
Sure, because after surgery, the patient can definitely have a coagulation issue or anemia issue, and we need people to get up and move around after surgery as much as it is possible for them to do so. And if they're anemic, they're not going to be able to do that the best. Or if they
Mm-hmm.
have a
Oh, for sure.
coagulation issue, they could be in some serious danger. So we really have to follow up afterwards.
Yeah, and do what we can to help
Absolutely.
them recover. If they've lost blood or if they're anemic, help them recover that.
Mm-hmm.
Tolerate it to the extent that they can, and recover it. I think some of the things that an organization can include in their policies and procedures, we know that those lab values are so important. They tell us where the patient is, but by taking the minimal amount, especially if a
Mm-hmm.
patient is starting to
Yeah.
show signs of anemia, maybe minimal blood draws, or the amount of the blood draws. That's always something that is pretty easily implemented in a policy to help conserve the patient's blood. Also, I think
For sure.
boosting the patient if they need iron or EPO, giving them the building blocks back to make their own blood.
Mhm.
Yeah.
And really educating the patient to ask what their blood draws are for. If they see that they're getting multiple blood draws, they educate them that they should be asking what those are for, and help them to know what they should be feeling like and what their labs should look like.
And what do you recommend if someone kind of runs into a bleeding problem, maybe after their surgery? Do you just throw blood at them? Or is there testing or things that you would do to try to figure out exactly what the need is?
Oh yes. when I have a question emerges about if we need a transfusion, I always request my partners or my students to identify or characterize the situation. If we have problems with education in patients, the most problem in health is the education in healthcare professionals. We don't optimal face the situations, especially related with blood conditions. We are trusting indiscriminately in transfusions and see the transfusions as the standard procedure for correcting all the blood problems. And I always tell my students, if you need to transfuse, please go in the exact way for deciding this, because it's easy to decide a transfusion, but the most of the scenarios, your transfusion will be wrong or not needed. In this situation, we always request to our people and students to make sure the exact necessity for be transfused in a patient. Point of care lab technologies are especially for those situations. A blood gases analysis is a good starting for the site.
You got to understand the problem before you fix it. Is that kind of what you're saying?
We need to be sure what's the hemodynamics of my patient. We need specifically to know how is the blood volume, how is the hemostatic status, and we use some technologies for make sure the patient is optimal. We use, for example, thrombelastography or ROTEM in that situation, and combine the information from ROTEM or viscoelastic test with the blood gas analysis and another point of care diagnosis technologies. And we articulate all this information for deciding if my patient is able to go without a transfusion. It's a very hard decision, but it's not impossible. It's important to know this. Yes, the easy way is to transfuse everywhere, everybody. But
Right.
the game here, the tricky is to be sure you are doing the optimal treatment, the optimal
right
approach
thing
for your patients.
Yeah.
Where we are.
Thank you so much for having this conversation with us today.
Yes, it's been such a pleasure speaking to you. Such an honor. We greatly appreciate it. We hope you enjoyed this conversation and found some takeaway or new thought that improves your health. We would love to hear from you. Feel free to reach out to us on our website if you'd like to see what we're up to. Our website is letstalkpbm.com. If you enjoy our conversations, please like and subscribe wherever you listen to podcasts and on our YouTube channel.
Special thanks to our guest and our producer, Delaney Coronado, and the entire production team for all of their expertise in content creation, technical abilities, and dedication to our message. We appreciate the experts who drive this medical movement forward, and our affiliate partnerships who support the work that we are doing. Until next time, stay connected to your blood health.